second part of, the discussion we had in the last video, how to eliminate or minimize anxiety. Before proceeding, please make sure, if your anxiety is just keep going more than a few days, okay? So you just consider check with your doctor, because they have tools to assess properly, exactly, so the root cause of your anxiety before getting to the chronic stage, because anxiety brings lots of cortisol in your blood, in your brain. When cortisol is very high, it can destroy arteries, it affects on cardiovascular system, it suppresses, immune system, and your body is at high risk. So please make sure you check with your doctor if you're suffering more than a few days, suffering anxiety, and you cannot control. But here, hopefully, we are just going to present more techniques to help you to eliminate anxiety. And please, darling, don't think anxiety is only for you. Anxiety is a part of the life, because we are dealing with life demands, life challenges, sorry, and so it is for everybody. But there are techniques for, to promote self-soothing and self-regulating by tapping and triggering parasympathetic nervous system, which is responsible for rest and digest. Not only for rest and digest, for love, for just calm down, for get, fully, connected, calm and collected, and immune system be resistive to infection, to any diseases. This is all parasympathetic. So this is very, very important. So before proceeding, again, how do we know our parasympathetic nervous system it is dysregulated? So there are a few tests we can do together. Start from your eyes. Okay? You practice mindfulness meditation before. Remember, you just close your eyes, you took a few deep breathing, and then you got familiar with your thoughts, or thought wandering in your brain, in your mind, okay? So just take a few minutes, take a few breaths, deep breath, breathe in, hold on, breathe out. Okay, one or two. After that, you check what type of thoughts is wandering in your mind. If your thoughts is all around the things happened to the morning and yesterday or last year, or is worrying about the tomorrow, what's going to happen tomorrow, it means your parasympathetic nervous system is dysregulated. It needs to be triggered and needs to be balanced. Okay? This is the first test. Very easy, right? The second test, so it is optional. This is all depends on your preferences. You go to your nostril. Right side of nostril is the, sympathetic nervous system located. Left side is parasympathetic located, right? If you put an index finger under your nostril and 3 times exhale, like that. Then if you see which part, right nostril or your left nostril, which one is dominated, okay? Instead of being equal, one side is dominated, okay? So it means your parasympathetic nervous system is, dysregulated. Another thing, which is very, very easy, because in your mouth, at the back of the tongue, inside, the soft palate is all, full of this network of parasympathetic all around, go from inside and goes inside your ears and then go down to your neck and then go down to your chest area. It is like a network, right? So now just we focus this test on your mouth. If you have mirror, small mirror like that, open your mouth and see the small tiny tissue epiglottis. I think it is 9 in the middle, and it is always in the middle in the center. Okay? If it is deviated either side, it means your parasympathetic nervous system is not regulated, it is dysregulated and needs to be triggered to be balanced again and to help you be relaxed. Okay, now this test we did and we noticed the body of a parasympathetic nervous system needs to be regulated. Now you can check also high vagal tone. High vagal tone or low vagal tone. High vagal tone, you have ability to soothe yourself, to let it go, to just take it easy to yourself. Let it go. You are having high vagal nerve tone. But if it is not easy for you to let it go, it is not easy to regulate and then put yourself in the, self-soothe condition, it means you need to get balance in your parasympathetic nervous system, and something, needs to be done for yourself to de-stress yourself, bring peace and harmony in not only your nervous system, your heart, in your brain, and systematically, and get, along nice and peaceful with your life. Okay, so we did the test, we know. So how can we stimulate vagal or sympathetic nervous system? In last video we had one technique called Valsalva maneuver. Remember Valsalva maneuver? So the pack or network of parasympathetic is sitting next to the tailbone. That area on your pelvic area, when you just contract it, okay, like little bit, put a little bit pressure, not too much, little bit pressure, that you sit up, you are sitting on the chair, you feel, you just move, that pressure is enough. This stimulates parasympathetic nervous system. Okay, now we have another way, very simple to do that and very effective, very, very effective. Okay, so we started with, we know parasympathetic goes from mouth and inside the auricle, this is ear, okay? With your thumb, hold your ear down there like that, and then put your index finger inside, very gentle, one massage, keep massage inner canal, 1, 2, 3, 4, 5, this is forward, now backward, 5, 4, 3, 2, 1, you can do both ears. Auricle, parasympathetic nervous system is there, okay? So you can do it anywhere. You can do it when you are sitting in your office, you feel a little bit tired, a little bit off. Okay, you do it, you just playfully. It is very easy. Okay, use your index finger and your thumb like that. Easy. 1, 2, 3, 4, 5, 5, 4, 3, 2, 1. That's it, done. And here, this area, parasympathetic nervous system as a network here. There are jugular vein, there are so many arteries going to the brain. You got to be very gentle with your neck. Don't, just gentle massage, like a vibration, like a gentle massage. Okay, like a gentle massage, and in a circular way. That like a touching a little bit, not too much pressure. Okay, so because it's very important, the arteries going circulate oxygen to your brain doesn't get stale. Okay, this is very important. Okay, now this is another technique which is fun to do that and easy to do that. What is that? Usually this technique using in different types of meditation. First of all, I was thinking the sound is very rhythmic, a slow, smooth sound, like a like that. It reminds me the name like mother, because in some languages, means mother, or Mother Earth, or your own mother. The word mother is soothing effect on the parasympathetic nervous system, right? But I was not right. This sound create vibration inside, because all inside there is parasympathetic nervous system. This vibration, uh, this vibration like that stimulate parasympathetic nervous system. Okay, now we do it together. Ready? Are you ready? Okay, relax. You can close your eyes. You can keep your eyes open, no problem. You see? Now, take a deep breath, then hold on, then exhale. During exhaling, you make it so. You see now? You can do as long as you can. This exhale, during exhale, you make a sound, but in some type of meditation, the word is clearly like a like depends on your taste as well, as long as you feel vibration. This vibration stimulates parasympathetic nervous system. Okay, this is another technique. So I started auricular, you stimulate nervous system here, it's parasympathetic, you vibration in your mouth, singing, singing. Just just sing. Listen to music and sing together with music. This is type of stimulation as well. Chewing gum. Chewing gum also stimulate parasympathetic nervous system. Crying. The study shows crying also help to stimulate parasympathetic nervous system. When you make this very smooth, continuous, slow sound, sometimes you feel saliva in your mouth. It means you are doing a good job, because the saliva, increased saliva in your mouth, it means sympathetic nervous system is fully stimulated. So there are two more techniques which is very, very powerful, very, very effective. I use them for my own patients, because I was doing pain management and behavior management. I used this technique and it was really effective. One of the type of the technique, respiration technique, is chin lock. Okay, chin lock technique. Okay, when you chin lock here, you have to hold your nose, close your nostril. Okay, we do it together first. You can do. We count from 1, 2, 3, 4. Okay, inhale, hold, exhale. Okay. So at the beginning, a little bit confusing for you, but you will be master to do that. Okay, you will be fully competent to do that. Easy after 2 or 3 time you are doing. It is very, very important. What is doing actually? There are parasympathetic in the larynx. This area, you are pressing that area, stimulate parasympathetic nervous system. Okay, I do it now again without talking. Okay, now inhale, hold, exhale. Okay, inhale, so inhale. I counted 1, 2, 3, 4. Inhale, then hold. I close my nostril and my cheek just touch here, this area. Don't press too much because the parasympathetic nervous system need to be touched gently, okay? And then exhale, exhale. So just the same 1, 2, 3, 4. You count. When you're doing 1 or 2, 3 times, it is much easier. This technique is very, very effective. And you feel saliva. Already I feel saliva in my mouth. It's too much. Yes, I clean it up. Okay? And also you can have a little bit water to clean up your mouth, to wash it down. Okay? Now, another technique, and I'm using a lot, I use a lot for patients who have pain, very bad pain, non-pharmacological pain management. It was my job. And then also non-pharmacological approach to behavior management. And I use all this technique to stimulate parasympathetic nervous system, and then they completely got relief of not only an anxiety from pain too, and they were thinking there was something with my hand. I didn't, it was their own body response beautifully, was nothing in my hand. They believe my hands, thanks, it helped them to, to process their emotion. It was okay. But as long as, what happened, they created very nice rapport, very nice communication with me. That is why they had a good feeling in our communication, and it helped them also to just facilitate the whole process to get relief of the pain, to get relief of all the, unwanted, behavior or aggression. Or I have a few cases too, but over time doesn't let me to mention that many scenarios I have in relation to pain management and behavior management, and using tapping and trigger parasympathetic nervous system, and it worked for my patients. And hundred of them, I have the list of hundreds of them, work for them without using any medication. For pain, no analgesic, and behavior they come down with this type of mindfulness meditation together with technique, respiration or respiratory, technique. Chin lock, it was one of them, and diaphragmatic, deep breathing diaphragmatic technique. So what happened? Because parasympathetic pass through all the throat, goes on and branch all over the network, go to the all chest, go down, cover all the chest area, goes to lungs, goes to heart, and goes to, gastrointestinal tract, and then the main organs. So it covers everywhere. So what we do with diaphragmatic breathing exercise, or belly exercise sometimes it is called, it stimulates parasympathetic here. Now I am going to do that with you together. Okay, sit, relax, and make sure your arm on your lap, comfortably. Your back is straight up your back to, you know, to open the pathway for the energy to just go up and down for all the neural pathways, clear and easy. Now, you do the same what I am doing. We do it together. 1, 2, 3. Take a deep breath. Hold to it as much as we can. And exhale forcefully. When you exhale very forcefully, and you do it in 10 rounds, depends on how much you can tolerate, okay? So this is the best technique that relaxes. Most of the time, I use this technique for my patients, and it worked beautifully and was so happy. Not only those patients minimize taking analgesic painkillers, and even sometimes most often they refuse to have tablets anymore. They didn't need because parasympathetic work for them, make them, uh, relax, de-stress, and they were in the sense of peace and harmony. So this is nice technique. The last technique, which I am not very happy actually with that, is tummy tapping. This is yoga exercise or doing that. Some yoga, techniques, a little bit I found a little bit harsh on some people, included this tapping on your abdomen. What they do on the, uh, mm, belly button, around the belly button, they tap 1, 2, up to 30 times they tap onto that area and then relax again on top of that area, tapping, 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 and then they use thumb, put in the belly button, and then little bit press inside, and then rhythmically put your fingers, put your thumb up and down. Then the last is they put 4 fingers on the belly button and do the same. I am not very, very much keen about this exercise because of my background, medical surgical background, give me a little bit of insight that those, not everybody having very happy tummies. Some people, they have irritable bowel syndrome. Some people have, like a epigastric problem. Some people have peptic ulcer. Some people are on anticoagulant tablet, blood thinners. Okay? So please, if you want to do this technique, tummy exercise to stimulate the parasympathetic nervous system, please, please, please make sure you check with your doctor. Especially if you have, there are some people have maybe cancer in some organ of the body, cancer on liver, cancer on pancreas, cancer on stomach, and they are under chemotherapy or radiation or something. For me, this is big no. Okay, probably this is based on my experience. Maybe your doctor has different assessment about you, and then doctor might suggest you do another technique like, deep belly breathing exercise or diaphragmatic exercise, which is very safe and no danger. Okay, so I hope these techniques help you a lot, and please make sometimes to look after yourself, do meditation and look after your parasympathetic nervous system because it helps you a lot to de-stress, eliminate your anxiety, and bring peace and harmony to you. There are just crossed my mind, if you're just, you don't know, you're stressed, okay, now you're sitting, you feel you're a little bit off, and you sit because you're familiar with your own body, you're familiar with your own body sensation, you feel, I don't know what's wrong with me. I am not feeling okay. I am not feeling, I'm a little bit off today. I am a little bit irritable today. I am a little bit impatient today. That is a good sign because you're familiar with your own body. This is a good sign. Some people, what they do, this sponge, stress ball. If you have two stress balls together, okay, this is one technique. Wash your face with cold water. Some people, what they do, they put the cubic ice in the bowl and put the face. So this is immediate, stimulate parasympathetic nervous system. Some people put ice pack on the chest. This is also another. Or you take a bubble bath, and then when you are in the top bath with bubble and playfully, with the foam, with the water, splash it like a baby, like a child. You just have fun. Okay, this is another. Or take a hot, cold shower. Cold shower is very good because when you put cold water shower with cold water, do like this, right? So immediately you get all the oxygen sent to you everywhere, including your brain. Your brain gets highly oxygenated blood and you feel okay. So swimming, because hydrotherapy is the best thing. If you access with water, even wash your face with cold water, tap water, swimming, this all helps you a lot. And some people, in some references, some resources suggested heating, heating the uh, punch, punch the bag or something like that. But I am not very keen about that as well because this is like sort of aggression, I think. We are trying to calm down, not aggression, right? So I am not very happy with that. I prefer to listen to the soft music, even move your body nicely, dance with the music, enjoy yourself, have fun yourself. Okay? And darling, you are not the only one. You get anxious. It's all you are all the same. Okay? Don't get disappointed. Don't get frustrated. And don't label yourself, I am anxious person, I am nervous person. This title doesn't suit you. Okay? Because this is just feelings. And you have control over your feeling. And good luck with your parasympathetic vagal nerve to, regulate it the way you like, and then stay peaceful with your life and enjoy everything. Okay, so I think this is a time to say bye to you, but please make sure you press the bell, like, and subscribe. With love and gratitude, have a lovely day and God bless.